All right, good morning. Y'all can do better than that. Good morning. All right, it is such an honor to be here to make an announcement regarding Detroit's new Chief Public Health Officer. I want to start off by thanking the phenomenal men and women of the Detroit Health Department for the work that they have done in Detroit, and give a lot of credit and respect and honor to our former Chief Public Health Officer, Denise Fair-Razzo. Let's give her a round of applause. She served our city diligently for over 6 years and really laid the foundation for a lot of the public health work that has transpired here in the city of Detroit. Today, we are announcing a new leader, a new strategy to ensure that Detroit's public health approach is bold, innovative, and fully integrated into how we govern. The Detroit Health Department is already an essential resource in our community, providing childhood immunizations, restaurant health inspections, transportation for maternal and well baby visits, and leading efforts to reduce teen pregnancy and childhood lead poisoning. But I believe with all of the great work that has been done, the Detroit Health Department has the potential to do so much more. That is why I am proud to announce today the appointment of Ali Abazeed, who will lead now as the City of Detroit's Health Director. Where is he? Ali brings extraordinary experience to this role. He served as a founding director of Dearborn's Health Department, building it from the ground up and establishing innovative, high-impact approaches to public health programming and communication. He brings years of federal experience at the U.S. Department of Health and Human Services, including substantial work within the National Institute of Health. And most importantly, he understands how to translate public health theory into practical citywide action. Under my administration, we are embracing a health in all policies approach. That means, yes, give that, all right. I like that. Health in all policies. That means that public health would not be siloed within one department. It will be integrated into every single department, from economic development to transportation, from public works to recreation. In Dearborn, Ali implemented this exact model, ensuring that the health department was not separate from police, from public works, or economic development, but instead it served as a partner and an advisor to each of them. Detroit, we are rising higher, and we are doing it in a way that prioritizes our health and the well-being of our residents. I would now like to bring up our new Chief Public Health Officer, Mr. Ali Abazeed.
Someone's microphone went down. Let me get that up. We do this all live, so. Madam Mayor, thank you so much. There are certain moments. There's certain moments in public service where you kind of feel the weight of history, and you kind of feel the intoxicating possibility of what's to come. And thank you for your trust in me. I think we're going to do big, bold, and beautiful things in Detroit on behalf of the awesome, beautiful people of Detroit. And I'm really, really excited to be here today. My God, I see so many people from so many parts of my life, the DC parts, the Dearborn parts, the Dearborn Heights parts, the Wayne State parts. Thank you all for being here. Public health is a collective effort. Nothing here happens alone. Everything we've been able to do, both prior in Dearborn, DC, everything was possible because of the team. My former staff is here. So many people are here. Thank you all for being here. The mayor's on a tight schedule, so I want to thank you individually. We'll just keep rolling with it. Look, my craft is people. I love people. I center people at the work of my public health focus. I was born in Detroit, raised in Dearborn, 2 blocks from Tireman Avenue. If you know these parts, you know something about that border. You know what it represents. Something to say about segregation, something to say about disparities and inequities. It shows up in the built environment. It shows up in the air that you breathe. I grew up with asthma, and what I learned far before I learned the language of environmental exposure or social determinants of health is that what my lungs taught me, which is that your zip code tends to be a better predictor of your health than your genetic code. And I learned that in so many different ways. My parents, Syrian refugees by way of Algeria, came to Detroit. And my dad was a professor in his native Syria. And in Detroit, he drove a cab for 25 years. And you learn something about labor. You learn something about the kind of dignity that we all have in labor, but how it takes a toll on the body. My mom raising 7 kids and taking all of us to the old Herman Kiefer building when we didn't have care because Detroit was offering that. And so you learn something about how public institutions can step up and what it looks like when they do so for people that are closest to the pain. Because here's the thing, health isn't siloed. No parent views their kid's childhood asthma as something that's separate from transportation barriers, economic stress. It's all together, so why in the world do we treat it like it is siloed? And that's why what the mayor is doing today, that's why all these folks standing beside us are here, is because we're taking that health in all policies approach. And that health in all policies approach isn't the slogan. It's meant to sort of embed tentacles into every single part of the city government, because we know that 90% of your life expectancy happens in the communities where you live, where you learn, where you work, where you play. And so it behooves us to take that approach so that everyone here, from police and fire to parks and recreation to water and sewage, to every single agency, is working with that sort of insistence that health belongs to everyone. And we're going to do it that way here in Detroit. So what I want to say to the staff of the Detroit Health Department, my charge to you is twofold. One is use your boldest imagination. Think about, scour the state, scour the country, scour the planet for the best ideas and on what we can do to help improve the health, dignity, and well-being of Detroiters. I don't care what's palatable. I don't care what's feasible. It's my job to make those things palatable and feasible. It's your job to come with the best idea. The best ideas usually start with big, bold imaginations. And 2, step outside. You know, public health is not meant to be a desk job. And so I plan on being someone who's out in the community. I know Dr. Luke will be in the community. I know Benita will be in the community. The health department will be in the community. And so that's where you learn what public health looks like. And finally, I want to say to the people of Detroit, you know, to paraphrase the words of the late, great Reverend Jesse Jackson, every single one of you is somebody. Whether you're living through substance use disorder, opioid use disorder, whether you're living through an anxiety you cannot name, or a grief or a despair that you cannot sort of sense, I want you to know that we're going to have your back. I want you to know that if you have any doubt in us, keep that doubt. You know, I doubt myself all the time, to be honest with you. But the thing that I learned about doubt is you do and you doubt simultaneously. So I hope you let that doubt walk hand in hand with faith, not necessarily in us, but in yourself, to join us so that we build something that's worthy of your trust. Because I promise you, we're going to work our asses off to build a department that you can be proud of and something that you trust. Madam Mayor, I'm so glad to be here, but I can't wait to get to work, get out of here and go to work. But I'm really, really glad to be here with all of you. Thank you all so much, and thanks for everyone here being here as well. Thank you. And I'm really proud and excited to announce, to bring to the stage Dr. Luke Schaefer, the Chief of Health, Human Services, and Poverty Solutions. We're so lucky to have Luke here, by the way.
Thank you, Ali and Mayor Sheffield, and hello, everyone. I think this is a really exciting day for the Detroit Health Department, the city, and personally, I'm extremely excited to work with Ali Abazeed. Ali brings exactly the type of record of proven, data-driven leadership that we want at the health department. And that's not just because he has 3 University of Michigan degrees. He uses evidence to inform action that benefits residents in concrete and tangible ways. I also really, really want to thank Denise Ferrazzo and the entire leadership team at DHD for doing such a great job preparing for this transition. Ali and I got a binder that was like this thick that is incredibly valuable and just detailed. And because of their work, we're going to hit the ground running and build on the amazing programs that DHD delivers every single day. Over the last month, I've gotten to know the team at DHD, and they are tireless and committed to delivering impactful services. And so many thanks to each and every one of the staff. We are going to do really exciting things together. Ali's approach is the perfect match for Mayor Sheffield's vision to seek out innovative and cutting-edge ways to integrate health in everything we do. And his record speaks for the impact he has had and will bring to Detroit, including achieving a 60% reduction in drug overdoses in Dearborn and expanding air quality monitoring across the city. He also brought RX Kids to Dearborn, the same nationally recognized program that Mayor Sheffield recently launched here, making Detroit the largest city ever to adopt the maternal and infant health program. We already have 700 families who are enrolled in the program, $600,000 in cash prescriptions here. So I got to work with Ali on that and see firsthand his drive, his expertise, and his effectiveness. So we are ready to work together across departments and in the name of impact. That's why you have such a big group here today. And in that vein, I'm excited to bring to the podium Benita Miller, the incoming director of our new Department of Human, Family, and Homeless Services, who we are also incredibly lucky to have.
Thank you, Luke, and welcome, Ali. I love your energy. I am both proud and excited to be part of the Sheffield administration. And in support of Mayor Sheffield's vision to foster policies and programs that help communities thrive. Alongside Luke and Ali, I look forward to developing innovative and interconnected policies and programs that wed physical and emotional wellness to a focus on accelerating social capital, all with an eye toward alleviating poverty and catalyzing economic mobility in Detroit and for Detroiters. By breaking down the silos that often isolate physical health and well-being from family and community well-being, there are opportunities to share best practices, resources, and coordinated policy. We will create breakthroughs that improve the life outcomes and health conditions in Detroit and across communities. Ali, I look forward to partnering with you to advance health and well-being policies and programs that Detroiters can look to with confidence, ground them in hope, and promote healthy outcomes. Again, congratulations.
So before we close today, there's going to be a couple of speakers, resident speakers actually, that we want to highlight. Again, the Detroit Health Department is an institution. It's doing so much great work. And as the mayor put it, we're excited to expand what's possible as well. I want to bring up to the podium Megan Boyce, who directs our I Decide program. I Decide works with young people across Detroit, provides education, mentorship, and support so that they can make informed, healthy decisions about their futures. The program's fundamentally about agency. It's about confidence. It's about giving young Detroiters the tools to navigate complex choices with clarity and strength, and it fits into the mayor's vision of empowering our youth to make those decisions in a smart, savvy way. So, Megan?
Thank you so much. I'm Megan Boyce, and on behalf of the staff at the Health Department, we are thrilled to have you. It is an honor to be able to talk about the I Decide program a little bit. We launched the I Decide Detroit program in 2018 with the aim of reducing the unintended teen pregnancy rate in the city of Detroit. We offer services directly at the Detroit Health Department that are really a comprehensive approach to providing reproductive health care to Detroiters across the lifespan. We are able to see people as young as the age of 12 and really start the opportunity of building relationships with them so that they can make the best decisions about their health over time. We have comprehensive contraceptive options, preventative care like your annual Well Woman exam and clinical breast exams as we think about breast health as women age. And we also offer sexually transmitted infection testing and treatment to make sure that people are able to get care as quickly as possible so that they can be in control of their health. And one of the wonderful things about our program is that we actually offer transportation to and from appointments. So we are really reducing those barriers to care so that people have the opportunity to make informed and empowered decisions as they move through their life and think about how they want to shape and create their family, and that they have a safe place to get good quality information that is so important as they think about all of the aspects in their lives. So we are thrilled to have you. We're thrilled to continue to partner and really align ourselves with the greater vision of this administration.
And finally, I want to recognize the impact of our Fatherhood program. This is a program that supports dads across Detroit with mentorship, parenting education, workforce connection, and real community. When fathers are supported, you know, Mayor Sheffield in the first, month, Mayor, rolled out RX Kids. I mean, that's a big effing deal. And this is a part of that big, sort of thing deal. When fathers are supported too, families are stronger, and when families are stronger, neighborhoods are healthier. When neighborhoods are healthier, the city really does thrive. And so I'm proud to invite someone who's experienced this program firsthand. I just met him. He's awesome. He can speak to its impact. Christopher Marshall.
Thank you, thank you, thank you. My name is Chris Marshall. I'm 36 years old. I got 3 kids. Layla, Santino, Daisy. They 14 years old, 14-year-old, 15-year-old, 7-year-old. I got into the Fatherhood program. I actually stumbled upon it. It started, I was just out with the kids hanging out. They had a picnic, big picnic. I figured out the Fatherhood program was there. I started the Fatherhood program. We was real small, about 2 people, 2, 3 people, a couple people. Mike right here. Once you got Mike, you don't need nobody else. Once you got Mike, you don't need nobody else. But we started off real small. We're building up to about 25 people right now. The program kind of teaches you, it kind of gives you a cheat sheet. A lot of times you don't have no type of guidance. A lot of fathers, they want to do it on their own. A lot of fathers since COVID has lost a lot of people. Has made it to where you have nobody to talk to, you have nobody to build with, you have nobody to, nobody. So we get into the Fatherhood program. We run a lot of scenarios in there that you don't have to deal with on the outside. Your friends, your guys might go through something. Now you don't have to go through it, so they teach you how to move in certain ways. Since the program started, I've noticed that my temper is better. My emotional intelligence is better. I built more resources on my own. Before, my kids was harder. It felt like I have hell on high water, But now, it's like I got the hub for all the kids now to come to. We take kids out to games, teaching them different skills that they need for the community, et cetera. We're just trying to get all the fathers and then, just hearing this right now, all my UAW brothers that never thought that this was going to be possible, I need y'all to come tap into it like ASAP. All the fathers that need, that just that mental guidance, that you're not alone, that it's not over with. Every second Tuesday of the month, come down to 100 MAC, please. Thank y'all for y'all time.
All right, we again thank you all for being here. Thank you to all of the departments and appointees from the administration for being here as well. And we will now open it up for any questions that you all may have at this time.
Take questions over here, please.
Morning. Couple questions. What are some of the innovative approaches that the city expects to take within the health department? And Ali, why did you leave Dearborn?
I'll take the first part. So the health and all policies approach is something that is a best practice nationwide and something that we plan to integrate here as well. And so that's why we have all of our chiefs, our directors here behind us, just so you all can understand that health will be integrated within every aspect of what we do, not just programming, but strategies, but policies, but the way that we release programs, it has to be sort of considering the barriers that residents have and be tailored to each one of our residents. So this is all about equity. This is all about accessibility, and we're really looking forward to really integrating that within the entire administration. So.
I don't view it so much as leaving Dearborn. I love public health. I care a lot about public health. Mayor Hamoud was actually supposed to be here today. He had a death in the family. Mayor, thinking about you. He was incredibly supportive. He was a great partner for 4 years. We did big, beautiful things on behalf of both of our hometowns. And also the opportunity to expand the realm of what's possible within public health. Look, Detroit, you can't write the story of America without a huge chapter in there for the city of Detroit. This is one of the most historic cities in America, and that's not something I take lightly. And so when an opportunity comes to improve the health and well-being of this city, to work with this incredible team, to work for this mayor, for the people, that's not something that I was willing to ignore.
can you just talk about, and I'll let you go, can you talk about like some of the immediate tasks that you want to tackle?
Before he goes up, I did have some conversations with Ali that some of my main focuses will be chronic disease that continues to plague the city of Detroit, households that are impacted by lead, maternal and infant child health, and then also asthma throughout the city of Detroit. And so he has those 4 things that are in his mind as he moves forward, but I'm sure he also has some innovative ideas that he'll be bringing forth as well.
Thank you.
Hi, I think that sort of mostly covered my questions. Thank you. But with the health department having been through a lot of changes over the last couple decades, the city health department, I'm wondering if you could talk about sort of this new iteration of the department. Do you expect to expand it size-wise, whether that's funding or staff, keep it about the same, and anything else you want to say about sort of what this new iteration of the health department looks like?
So I think it's going to be based off the leadership of our new director here. If he comes back and says that there's need to grow, then we can grow accordingly, or it maybe stay as is. But we do want to bring innovation to the approach that we're bringing forward. And so we want to allow him the time to get adjusted, to get acclimated, and figure out what is best for Detroit, and then we will adjust accordingly.
Thank you.
Ali, congratulations. My question to you, and I'm appreciating this is just your introductory day. We live in a backdrop now where a lot of the messages in the medical community are conflicting federally, vaccine advocacy, other things. I'm interested in what you view your role as far as a lot of city government, from what the mayor and others have said in the past, is working toward what's good for the city of Detroit. The governor has said similar things for Michigan, despite maybe some roadblocks federally, policy-wise. And I'm not trying to carry on here, but when we have a Health and Human Services department federally, that many in the medical community believes gives contradictory messages. I'm just curious, as you step into this role, what you see your role as far as communicating to Detroiters about the importance of vaccines and other things that may contradict what we're hearing on a federal level.
I was in the federal government during the pandemic. I worked in refugee camps abroad. You learn something about the importance of communicating saliently with people. You learn something about what it looks like to communicate with humility on things that are kind of hard to communicate, to be honest. Once in a century, novel virus, that's hard. Something is changing all the time. And so the approach that we'll take is to treat health communications as an intervention in and of itself, because it is. Those are the lessons that I learned working in the federal government. Those are the lessons that we imparted in Dearborn. Our health communications apparatus was robust, it was strong, it centered people, it centered their dignity, and it centered the weight of recognizing that if we're communicating something accurately, that's going to change people's perception of their own health. So thanks for that question.
Thank you.
Hi, Louis Aguilar, Detroit News. You touched upon this earlier, but I just want to make sure I understand. So at this point, there's not much change in the budget in terms of what the new approach will be?
No
Okay.
change in the budget.
All right, okay.
And again, you will see the full budget March the 9th. And if there are any changes or proposals at that time, you will see them then.
Thank you.
Thank you.
Hi, Mayor. Wonder if you can just speak, I know Denise Ferrazzo is obviously kind of the face of the city's approach to the pandemic, and, what made you decide that it was time to make a change at the health department at this time?
Yeah, I think as we campaigned, there was a desire for a combination of institutional and existing leadership to stay placed, but also welcome in new faces. And the health department was one that we felt it was time maybe for some new leadership, not to say that there was anything wrong with the direction that it was going, but wanted to bring more innovation and new direction. And so very excited to have him and see what he brings to the city of Detroit.
Thank you.
Thank you. All right, that is all the questions. Again, we thank you all for being here. Let's give Ali again another round of applause and welcome him to Detroit. And that will conclude our press conference.